Hello everyone. Our research group is Zach, Luke, Bana, and myself, and we're working with Dr. Roche. Our topic is a comparative study of neuromuscular electrical stimulation techniques for mouse models. Our research is focused on regenerative rehabilitation and cellular therapy. This therapy can be used to improve the regeneration of skeletal muscle post-injury, and the success of transplanted tissue depends largely on the microenvironment it is introduced to. How NMES fits in. A variety of methods have been used to influence the success of transplanted tissue. NMES has received a great deal of attention in donor-derived muscle regeneration. NMES has been used to stimulate muscular contractions, which can increase angiogenesis, hypertrophy, muscle strength, and the secretion of growth factors. Some additional factors include an increase in muscle-derived stem cell engraftment, an upregulation and maintenance of VEGF, and to maintain and restore muscle function with the use of NMES.
Current methods of NMES involve simple electrodes used to stimulate skeletal muscle through transcutaneous surface stimulation. Presently, it's known that NMES can augment neuromuscular regeneration. However, there are currently no optimal methods for long-term stimulation. The use of implantable stimulators has been proposed to address this gap, but these devices have yet to be validated for their efficacy in muscle stimulation. However, they have been used in past research to stimulate the vagus nerve. In the long run, it's much more practical to have an implantable stimulator in clinical practice, so it's an important next step in the research. The purpose of the study is to test the efficacy of an implantable stimulator by validating it against the gold standard electrode, which is the GRASS S48 stimulator. We also decided to test a custom bipolar electrode against the same gold standard, and for both of these, the rationale is to establish criterion-related validity.
All experiments with live animals were according to approved protocols at Wayne State University. We used 6 healthy mice, 3 to 4 months old. This means they had a fully mature musculoskeletal system. For electrode testing, we did a one-way ANOVA. When we compared the external versus the internal stimulator, we used a paired t-test. The outcome measure to compare all of these was the force of a muscle contraction. This table represents our research design. For each electrode and stimulator, the same 6 mice were tested. Here we have the electrodes we used in the study. The 2 on the left are transcutaneous, meaning they're used externally. The one on the right is subcutaneous, meaning it can be used internally. For the purposes of this study, we used all of them externally in order to compare them. The one on the right is the only one that can be used internally. On the left, we have our gold standard stimulator, which is very large. On the right is our very, very small implantable stimulator. And the goal of this study was to see if they can produce the equal amount of stimulation despite the size difference.
For our results, the graph on the top is demonstrating the difference between stimulators. Here we see that the subcutaneous electrode mimics the type of electrode that must be used with an implantable stimulator, indicating that the needle electrodes perform just as well as the pen electrode and the commercial electrode. So subcutaneous electrodes per se are not likely to limit the effectiveness of NMES. When we compare an external stimulator to an implantable one, the external stimulator generates more force. Taking a look at the graph on the bottom left, the external stimulators were able to generate a max contractile force of about 2 Newton millimeters. Looking at the graph on the right, on the bottom, the implantable stimulators were only able to generate about roughly 0.5 Newton millimeters maximum. Even when the battery was charged from 3 volts to 4.5, the max generated force was relatively the same. For barriers, when we use an implantable stimulator, we can only use no more than 3 volt battery just because it will add weight to the animal. To conclude, the internal implantable stimulation system will not induce maximal contractions compared to the external stimulation system. However, it can be used with chronic submaximal to induce changes in the cellular environment.